On the other hand, when one sees some very peculiar relationships, for instance, when Hoku treats pain in the face or dental pain, the chances are that it's, again I'm speculating, but there is some evidence for this, that we're going through number 11 and 12 and 13 through the midbrain system. It's known that if you electrically stimulate directly in the midbrain, there's a technique called SPA where you stimulate directly, you implant electrodes chronically in the head. If you stimulate directly, you find that you only get, say, a quarter of the body is analgesic, or a third of the body, very often, say, a whole limb or a whole side of the body. It's very possible that Hoku is stimulating this system, and there's a map in here which relates to the Hoku point on the hand, and perhaps the output here goes to the face and the neck and so forth. That is, there are some peculiar maps which haven't been carefully studied yet. So it's a speculation, but I think it's a reasonable speculation that Hoku works that way. That is, we're now talking about acupuncture effects at a distance. Now, how distal points work, how a point on the distal part of the meridian will affect the entire meridian, is a little more difficult to work out, because part of that meridian is clearly in the same segment, so you're dealing with segmental effects, but part of that meridian is clearly outside the segment and many segments away, and that perhaps again we're dealing with a midbrain map operating on the more faraway parts. For instance, Hoku, while it works fine for this whole dermatome, also works quite well for regions up here and further on. And I suspect that now we're getting outside the dermatome. Clearly the face is outside the dermatome. We're jumping into the map of the midbrain. But again, this is speculation. Now, but we also know that Hoku will produce pain relief over the entire body as well. And that must operate through a system like the pituitary, where now the hormone is distributed all over the brain through the CSF, or all over the body through the blood system. Now, how does one put all these three stories together? Like, let's say we're stimulating Hoku. What's happening? Well, you might get a 25% analgesia through the general system, and that will cause pain relief over the entire body. And by the way, this has been very carefully documented. A study in China by Chang showed if you do give Hoku to a patient and test for pain anywhere in the body, there will be an analgesia, but it's not very marked. It's a subtle, small pain relief, not enough to cure a patient of his total pain. So there is a small effect from this general system. Now on top of that, let's say you get another 25 or 30% analgesia from the midbrain. So you got 25 plus 30, you got about a 55% analgesia. Plus, let's say there's also a local effect. So let's say you're giving Hoku treatment for pain in the elbow or pain along, the arm. You'll have the benefit of all three systems, so you'll get a maximum analgesia, because both 9 and 13 and 17 are all operating together, and they're adding their effects. So the best effect would be Hoku for a local problem. A weaker effect, but still useful, will be Hoku against facial pain. But it's been shown quite clearly that if you compare the analgesia against facial pain by treating Hoku in one set of patients and treating local segments directly over the area, the trigeminal nerve, there's a much stronger analgesia from the local segmental treatment than there is from the Hoku. It sort of fits what I'm trying to say.